Bonjour tout le monde. Je suis content d'être accompagné du ministre de la
Happy
Santé,
to be with the
Dr.
Health Minister, the National Director of Public Health, and the Education Minister. And I'm almost hesitating to say this, but we do have some good news today in a context that I understand people have a lot of fatigue and it's hard for Quebecers, especially that this is adding on. But we are finally seeing the light at the end of the tunnel. So first thing, and maybe you can ask questions to Dr. Boileau for more information, but regardless of the fact that we're not testing the same way that we've done throughout the pandemic, it remains that there is a confirmation from experts that the number of infections, so the number of cases, is stabilizing. And based on those experts, we have arrived a few days ago at the peak. So we should all remember the curve. So the number of cases, we are at the peak. So please remember, we've explained it from the beginning. It happens in kind of 3 steps. First step, we put in place measures. Second step is it has an impact on the number of cases. And third step, it has an impact on hospitalizations. So what experts have said, and obviously we are prudent, we should expect over the next few days to get at the peak of hospitalizations. So it should or could have an increase of hospitalizations over the next few days, and then we should arrive at a peak, and we eventually hope to see a significant decrease in numbers of hospitalizations. So when I say we have good news, well, the good news is that this means that the measures that we've put in place, which were hard at the end of December, well, all those sacrifices from Quebecers have had an effect on the number of infections, and we hope eventually on the number of hospitalizations. Now, the other thing that's important, and I will let, if you have questions later, I'll let Dr. Boileau explain this better than I can. But from what I understand, and this is unanimous in the world, so the Omicron variant, yes, it is more contagious, but it is less severe on the health of people. What this means is that when we think of all the measures that need to be taken, well, it has less impact, and that is also good news. So although we need to remain prudent, and I'll never repeat this enough, even if we are at the peak or we are getting close to the peak, it remains that the peak is very high. We have a lot of hospitalizations. It's possible over the next few days that the number of hospitalizations may increase. So it's possible that the next weekend, it might be the hardest weekend from the beginning of the pandemic in the healthcare system. So we've taken measures to face this. So that's the other encouraging news. Christian Dubé with Sonia Lebel and Jean Boulet have had many discussions with the 5 or 6 representative of unions, and we've been able to announce this morning certain measures, significant measures. It cost $1 billion to the government. It's going to cost $500 million. So those are financial efforts made by Quebecers as well to help to get through this. Now, in the measures, there are 3 types of measures. First measure, well-being or quality of life measures. So, paying for parking, paying for taxis, paying for food, give holidays when it will be possible to do so. So everything having to do with well-being and quality of life. So second measure are incentive measures. So for example, double time for patients who are able to or accept to give more hours to the healthcare network. And third measures are administrative measures, including ensuring that we add people, even if they have less training, or doing the administrative part and being able to unload the nurses or unload certain tasks from the nurses. So I want to say this, it's important for us. Thank you to all 5 union leaders. I think it's important for us to all work together to get through the next few weeks. And I think that with these measures, it's going to help. Now, this will also give us time to arrive with other measures. Now, you've seen all the training, the accelerated training. Again, thank you to Quebecers who are interested. We've opened 2,000 accelerated trainings for auxiliary nurses. They've had 18,300 registrations, and we've opened new positions for administrative positions, 5,200 new registrations. Now, obviously, there are bursaries as well. There's financial incentives, but still, it's encouraging to see that all Quebecers or some Quebecers want to come and work in our health network, our healthcare network. Now, obviously, it's going to take time to train them, even if it's accelerated. But even then, we're seeing the light at the end of the tunnel. So the big news today, and that's why we have the Minister of Education here, we're very happy today. Public Health, the National Director of Public Health, we've announced today, or actually last night, that all schools in Quebec will open next Monday, so June 17th. I'm never going to say this enough. How important is it? Because remote education isn't the same. You have problems with dropping out, you have addiction to screens, certain mental health issues with certain young people, all types of problems. So very important for young people to see their teachers again, go back to their teachers, go back to school as soon as possible. I think we're never going to say this enough. The priority in Quebec must be education. Now, there might be, and not just might, there are parents and teachers who are probably worried about how this is going to happen. But again, and maybe I'm going to let Dr. Boileau later on give you more information about this. But from what I understand is that we have a brand new virus with Omicron variant. So it's a completely different situation that we're experiencing and that we are going to experience in our schools, in our classes. This new variant has much less impact on young people, especially those who are vaccinated. So that's important to mention, and I'm going to repeat it. In high school, 98% first dose. Elementary school, 60%. And teachers, I'll remind, since late December, we've actually let them go in front of other people to get their third dose. So it's important for that as well. Now, the other thing as well is for a certain number of weeks, and we hope not too long, all young people, all children will have to wear a mask. So that's going to protect amongst themselves, but also protect our teachers. And we are going to continue distributing quick testing as we get them, or rapid testing. And other good news is that the purchasing team were able to make an agreement with a Quebec company called MedSup Médical from Ville Saint-Laurent, who are going to give us over the next few months, it's going to start in the next few weeks, 70 million rapid tests. and part, now it's going to come from abroad, but eventually part will be manufactured here in Montreal. And you know how we said how important it was to be autonomous for medical equipment. So there's a right step in that direction. Now, once again, I did ask many questions to Dr. Boileau on the ventilation in schools, and Dr. Boileau has reassured me saying that it is safe. The situation of air in the classes, so that's important. Same thing for protocols. So protocols, when there's a child who will have COVID, you have to understand that the situation is different with the Omicron variant. So we're going to ask the kids to isolate for 5 days, same as with daycares. Now, the other significant news, and I did promise that the first measure, once we see the light at the end of the tunnel, and that's the curfew. So I'm announcing from Monday we are getting rid of the curfew in Quebec. And I'm going to repeat it, and I know that it angered a lot of people, but the reason why we did this was to stop the exponential growth of the number of infections and hospitalizations. And because we seem to have attained that peak, we are able to get rid of the curfew. Now, the other important thing, to help businesses that have difficulty finding employees, we said that for 3 Sundays we asked to close businesses. So the third Sunday is this Sunday, January 16th. So that's going to be the last day where businesses will be closed on Sundays. The other announcement we did, now we had discussions with representatives, business representatives in Quebec. Now, I understand there was a lot of worry for small businesses who didn't have the employees for the new rules to apply the new rules. So I'm announcing that large surfaces, so defined as 1,500 square feet or more, will have a vaccine passport. So currently, you need 2 doses, eventually 3 doses to be able to go to Canadian Tire or those places, excluding obviously food stores or pharmacies, which are essential services. Now, other points that I want to mention, and we've heard a lot about this over the past few days, over the last 2 weeks. Some people are thinking, what's the point of being vaccinated? There is no advantage over those who are not vaccinated. Now, first of all, I need to tell you, you made the right decision to get vaccinated first and foremost for medical reasons. Now, even if the risks are lower, it remains that the vaccines protect against severe consequences in the hospital, and eventually, over the next few weeks, we want to reopen restaurants and theaters and being able to get back to how it was before Christmas. So with the vaccine passport, so those who have been vaccinated, they will be able to go to restaurants and go to a concert hall or go to the movies or go to large surfaces, large stores. Now, the last point, and I want to come back, and we've been talked a lot about this since Tuesday, it's the health contribution. First, I want to say, yes, I know that opposition have asked for this. Yes, there will be a debate at the National Assembly on the health contribution. All members of the National Assemblies, all parties will be able to vote against it and offer adjustments and suggest adjustments if necessary. So from the start, early February at the National Assembly, we will lay down a project for this health contribution. And another important thing that needs to be mentioned, the intention behind the health contribution is not to hurt people who are vulnerable. Certain examples have been given by the opposition over the past few hours. You know, we're talking about the homeless or people who have a disease that stops them from getting vaccinated, or people even who have certain mental health problems. There is no question of hurting people who are vulnerable. What we are looking for is to tell people who choose not to get vaccinated, well, there is a price to pay for that. There is a price to pay for that because there is an impact on society. There is an impact on cost for the healthcare system. And obviously, it is an incentive to try and protect them themselves, because we hope that some, and actually we're seeing it maybe a little, who will choose to go get vaccinated because there will be a health contribution. So protecting society, protecting our hospitals, and protecting these people. Now, I'm going to finish by saying that obviously it's a small step that we're announcing today. We're looking forward, and I'm looking forward. I'm thinking of people who do sports, young people who do sports, people who want to go back to seeing shows. I'm thinking of those who are looking forward to going back to restaurants. We are all in agreement of that here. But we need to go progressively. We need to go progressively. We need to move forward. And Dr. Boileau is following the situation day by day, and I would even say hour by hour. So I'm going to finish by saying be patient. Let's be patient. Let's be careful. Let's be prudent, because we know after the winter comes spring. So thank you, everybody.
Good news today. Experts tell us that we have a new case, that the new cases has peaked. The wave of hospitalization is expected to peak in the next coming days. This means that the measures we've put in place have worked. We're going in the right direction, but we have to remain very careful. Number of hospitalization is still very high and will maybe continue to increase for the next few days. Another important development is about the work that has been done with union leaders. And today we announced new measures to help workers in our hospitals. As it was announced last night, Public Health has recommended that we reopen schools next Monday. This is a good news, important, very important for our children. I know that some parents and teachers might be worried, but Omicron has less effect on children, especially when they are vaccinated. We also ask everyone to wear the mask, at least in the coming weeks. We'll distribute self-tests in schools, and when there's a COVID case in a class, a 5 days isolation will be enough. CJEPs and university will also be able to reopen next Monday, and I'm happy to announce that we'll lift the curfew next Monday. We're also announcing that vaccination will now be mandatory for large stores of more than 1,500 square meters, except for grocery stores and pharmacies. So we're going in the right direction, but we must continue all our efforts. Thank you.